I'm back at Sunset Dental here. We've been talking about the clenching of teeth and some of the issues that can result, some of them pretty serious. In the example you were giving about the disc coming misaligned and out of joint, actually. I think what we want to convey to our audience is this can be a serious issue and one not to take lightly.
Yeah, you know, if you can't all of a sudden open as wide as you could, you need to get that looked at, because that can lead to chronic facial pain issues, maybe not right away. I have people come in with the same exact thing, but they've had it for 30 years and they can remember when it happened, but it never bothered them then. So they just kept going, which is unfortunate.
Yeah, well, in your example about the young girl that had the dislocation, would that have just stayed dislocated?
Oh yeah, that's not coming back on. We're just starting treatment here soon, and so that's what we're working towards, is to get that disc back on.
Well, let's talk about that. How would you do that?
Well, it's all about what we call decompressing the joint. Decompression of the joint means, we've got a little skull here, or a little friend, bring him back. And it has to do with every time you open, the jaw movement is what we call translational. In other words, it's forward and back. It can also rotate, and that's what the TMJ is so unique to the body. It's the only joint that can do translational and rotational motion. But every time you just open your jaw, it does that. It slides forward and back, okay? And there's a little disc in there. And so when you're clenching and grinding, you're back here pushing and squeezing blood vessels and nerves, and not to mention the disc, and it causes inflammation and can cause damage to the ligaments that are attached to that disc. And once that disc gets loose, then you're in trouble.
Okay. And obviously there's got to be some appliances that can help us to get that back in alignment. We'll look at those next on Medical Montana.